Good afternoon and welcome everyone to today's wellness webinar where we are highlighting mental health awareness during this holiday season. I am Tiffany Treadway, Communications Officer for Well Ahead Louisiana, and I will be your facilitator for today's presentation. Next slide, please. All right, just a little disclaimer before we begin today. The Louisiana Department of Health employees, contractors, affiliates, et al. Have no actual or potential conflict of interest in relation to this program presentation. The content herein is intended for general audience, not as legal advice. Laws and regulations take priority if there are any differences. Only LDH's secretary or surgeon general can give official statements. LDH cannot speak for other government agencies, and if you need legal advice, you should consult a lawyer. Next. Right, and our objective for today is to simply drive collaboration throughout the state that connects communities to tools and resources that can improve the health of our residents where we live, work, learn, play, and pray. And now let's hear from our Bureau's director, Dr. Nancy Lowenthal, with opening remarks.
Thank you so much, and good afternoon, everybody. I want to welcome you to today's webinar on mental health awareness. To provide some context, nationally, 1 in 5 adults experience a mental health issue each year. And in Louisiana, 715,000 adults have a mental health condition, of which 179,000 have a serious mental health condition. In the United States, 1 in 6 youth, that is youth between the ages of 6 and 17, experience a mental health disorder. And in Louisiana, 44,000 youths ages 12 to 17 have depression. Importantly, nearly 200,000 adults in Louisiana did not receive needed mental health care, of whom over 40% reported this was because of the cost of care. In Louisiana, hundreds of lives are lost yearly to suicide. Dr. Joseph, who we greatly appreciate joining us today, will help us understand areas of mental health, illuminating the differences between anxiety, depression, holiday blues, and major public health problem of suicide. The Louisiana Department of Health Bureau of Behavioral Health provides statewide oversight for behavioral health care, including mental health treatment services. And while mental health is an important topic every day, it is especially critical as we head into the holiday season. Well Ahead Louisiana is the chronic disease prevention and healthcare access arm of the Louisiana Department of Health. Our vision is to reduce the burden of chronic disease and assure access to quality health care for all Louisiana residents. We work alongside with leaders from the community, faith-based organizations, local and state institutions, and the private sector. We create an environment in which everyone can be healthy. We believe that everyone has a role to play in connecting Louisiana and communities to a healthier future. We are committed to educating and empowering leaders across the state with actionable steps to move Louisiana's health forward. Again, thank you for joining today's webinar, and let me turn it back over to my esteemed colleague, Tiffany. Thank you.
So much, Dr. Lowenthal. And at this time, I will take the time to introduce our keynote speaker for today, Dr. Erica Joseph. Dr. Erica Joseph holds dual national board certifications as an adult psychiatric mental health nurse practitioner and family nurse practitioner. Dr. Joseph has been a member of the nursing profession for 25 years. She has worked as a nurse practitioner in the specialty area of psychiatry and mental health for the past 17 years. She earned her Bachelor of Science in Nursing in December of 1999 and Master of Science in Nursing in May 2008 from Southern University in A&M College. She earned a postmaster in psychiatry and mental health from Southeastern Louisiana in December of 2012. She completed the Doctor of Nursing practice program at Southern University in December of 2015 and the Doctor of Philosophy in Nursing at the height of the global pandemic. She is a proud alumnus of the Substance Abuse Mental Health Administration and Minority Fellowship Program through the American Nurses Association. Dr. Joseph's research interest is examining risk and protective factors of minorities identified as high risk for suicide. Over the past 17 years, she has been committed to raising awareness of suicide prevention efforts and to the understanding of mental and substance use disorders. Dr. J, as she is affectionately known by her clients, has been employed as co-team lead of the Mental Health Intensive Case Management Program at the Southeast Louisiana Veterans Healthcare System, where she helped to start the program at the Baton Rouge Outpatient Clinic. She is the proud owner of Transformative Health, LLC, and founder of Transform Me, a nonprofit to address this important work. Furthermore, Dr. Joseph has received numerous accomplishments and recognitions, which includes being selected by the American Psychiatric Nurses Association as a champion for tobacco cessation. She was selected as the 2015 Louisiana Nurses Foundation Advanced Practice Nurse of the Year. In October of 2015, Dr. Joseph was selected as one of the 10 nurses to receive the national honor as a Robert Wood Johnson Foundation and AARP Culture of Health Breakthrough Nurse Leader recipient. In October of 2019, she was recognized as one of the Great 100 Nurses in the great state of Louisiana. In 2019, Dr. Joseph was the recipient of a personal coin from the Honorable Secretary of Veterans Affairs, Robert Wilkie, for providing excellence in healthcare to our nation's heroes. Dr. J is also a recipient of the Honorary Doctorate in Humanitarianism from Leaders Esteemed Christian Bible University. She is the past president of the Louisiana chapter of American Psychiatric Nurses Association and past member of the National Nominating Committee and current National Board of Directors of the American Psychiatric Nurses Association. And without further ado, let's give a very warm virtual welcome for our keynote speaker, Dr. Erica Joseph.
Good afternoon. Thank you so much, Tiffany, for that introduction. And thank you all for the invitation to present today for this important webinar on anxiety, depression, and holiday blues. One of the things that Dr. Lowenthal already mentioned, that 1 in 5 Americans are diagnosed with a mental illness at some point in our lives. So we can all understand the importance of gaining knowledge, understanding, raising awareness on this important issue that we all, at one way or another, may reach someone or see someone or even experience it on our own. And so today, I just would like for you all to walk away with a sense of how to manage your health and well-being during the holidays and beyond, what anxiety tends to look like, what depression look like, what how the holiday blues look like, and how to manage those. I always focus on without mental health awareness and total health. I think they all go together as one. We have to have in order to have that total health, I believe that we have to have a physical and a mental health component in which we take care of both. And so today, I hope that each of you walk away with something that you can help someone, help save a life, or also just help to better take care of yourselves. When we look at anxiety, anxiety is the most common mental illness in America. As mentioned previously, I do take care of those that have been diagnosed with a severe mental illness, chronic mental illness, and those illnesses tend to be more psychotic disorders. But anxiety is one that is very common that we see throughout America. And I would say in the past maybe 5 years, we've seen an increase in anxiety amongst our youth population as well as adult. And so it's something that we're seeing in the schools, we're seeing at home, it may be in your community. It's very prominent at this day and time. One of the things that we look at and when we see anxiety, they will tend to have unexplained feelings of impending doom or excessive worry. I always tend to say they worry about worrying. It's excessiveness. There's a lot of what if situations that they put themselves in, and it's more than involving like a temporary worry or a fear. It, I can describe it as equivalent to people have such fear that it's almost like a paralysis where they get stuck in a situation. They're afraid to move. They're afraid to um, go out into public. A lot of times it can be a social anxiety. And so we see it show up in many different ways. But the key thing to remember about it, if you think someone may be struggling with anxiety, that is persistent, is excessive worrying, and there's excessive fear about going into situations or dealing with people and that sort of thing. Several types of anxiety that most commonly that I see or is a generalized anxiety disorder or post-traumatic stress disorder. A lot of times people think that post-traumatic stress involves those that have maybe served in the military or have some combat experiences. But typically, anxiety disorders, as far as post-traumatic stress, can be someone who's been involved in a natural disaster, such as we've had our hurricanes here in Louisiana. A lot of times, if people have been involved in motor vehicle accidents, any type of violence, or even witnessed some of these events, they can also be dealing with or living with post-traumatic stress anxiety disorder. There's also anxiety disorders such as social phobias and things like that I've mentioned previously, whereby people have a fear of going out into public spaces and settings and actually interacting with people. Also, there's sometimes a panic disorder whereby people have panic symptoms in which it's manifest in a physical way by where they may experience rapid heart rate, they may be diaphoretic where they have excessive sweating, their palms may sweat, they may have tremor shakes. Those are panic disorders that we see, and people have what we call panic attacks. So those are some of the several types of anxiety disorders that we tend to see. Some of the symptoms that you may see when you're dealing with an anxiety disorder. The next slide, please. Some of the symptoms that you may see is excessive worry, as I mentioned, and that feelings of apprehension or dread or doom, like the worst case scenario is going to happen. There's always a sense of restlessness. It's challenging to get these individuals who live with anxiety to relax. They have difficulty concentrating. Sometimes it manifests itself as irritability or agitation. And also, it can be a sense of physical manifestation by where they may experience pain. A lot of times we see individuals show up, they may complain of chest discomfort, and they may think that it's something heart related, or they may complain of gastrointestinal symptoms where they may have upset stomach and that sort of thing. And they're thinking that they have something physically going on. So a lot of times what we have witnessed is individuals will go in and first see their primary care physician or their primary care nurse practitioner health provider, thinking that they have something physically going on, when in fact it may be anxiety related. And so one of the things that's challenging is that getting a complete history and also being open with the providers help them to determine if it's something physical or if it's also something anxiety related or something that they're dealing with as far as their mental health goes. Oftentimes, we'll see insomnia or difficulty sleeping. It could be a situation where individuals have trouble falling asleep or trouble maintaining their sleep. And they also feel a sense of tense and they also feel just restless, jumping on edge. A lot of times, when we are treating anxiety disorders, we provide medication that sort of take the edge off. If someone has symptoms where the anxiety is so tense that they're not able to function throughout the day. But then there are also medications that people can take every day that's just sort of subtle symptoms. They have a mild anxiety where it sort of keeps their mood sort of even on an even keel. It keeps their mood even and level where they don't have to take the panic symptom medicine, which is quick and fast acting. One of the things we like to do with individuals that are diagnosed with anxiety disorder, The first line of treatment usually is psychotherapy, whereby they may be referred to an individual who has been licensed in mental health counseling. It could be a licensed professional counselor, a licensed clinical social worker, an adult psychiatric nurse practitioner like myself, or a psychiatrist or a psychologist. So those are all the mental health professionals who can help individuals who are living with anxiety. And that treatment can be in a one-on-one setting, which we refer to as individual psychotherapy, or it can be a group setting if that person does not have a social anxiety or a social phobia. When we look at depression, depression is the leading cause of disability in the United States. We often see depression and anxiety go hand in hand. Most times, whenever I'm treating anxiety, most times they will have a diagnosis as with depression as well. Depression is a common illness. If it goes untreated, we do tend to see major consequences and tragic consequences in that it leads to disability, whereby individuals have trouble getting up out of bed. They lose interest in doing things. They're not motivated to do things. It may impact their work, it may impact their relationships. And one of the major and tragic consequences of depression that goes, a clinical depression that goes untreated, is suicide. And so, what does depression look like? It's more than having the holiday blues, which we'll get to in a minute. Depressed mood and sadness, tearfulness, emptiness. Individuals who are diagnosed with depression, they tend to have these symptoms over 2 weeks. They're persistent, they're consistent. They sometimes wake up with them every morning, and it's more than you just feeling sad or having a blues and a like a consistent manner in which we see it more than 2 weeks at a time. There's a loss of interest in things. There's also a lack of motivation. There's a lack of drive. There's difficulty with sleep, as I mentioned previously. Sometimes with depression, individuals can sleep like all day, or they may have trouble sleeping, like I mentioned previously. And so, if there's someone who you know that maybe you call and they're not answering, they're isolating themselves, they're telling you that they're sleeping all the time, then look a little deeper and not think that they're just fatigued or they're just tired. They may be dealing or living with depression and they're not even certain what that looks like. So difficulty with concentration is another thing that we usually see. We also see changes in the appetite where individuals may eat more or they may eat less. Sometimes people eat depending on their mood, and so they may eat a lot of junk food, a lot of sweets, a lot of chips and things like that that are not nutritious meals. We can also see a change in mood where individuals may have more anger outbursts, they may have more agitation, they may have a loss of hope or hopelessness. And when that happens, we tend to get real concerned because we watch them closely because we get concerned about if they having any suicidal ideations or not. There's a feeling of worthlessness. There's sometimes a feeling that they're a burden to others. And then those unexplained physical problems show up again that I mentioned previously that we see with anxiety disorders. And also, if someone complains of just not wanting to be here, they talk about not feeling like they are worth anything. That's that worthlessness that comes in. Then it's always key to get them into a healthcare provider to do an assessment whereby they can check and do a questionnaire to determine if they are experiencing any suicidal ideations. A lot of times there are myths around asking questions about suicide. Sometimes there's myth that if I ask, then maybe that person will take their life or they may start to think about ways to take their life. But I will just say that that is a myth. If somebody comes and say that they have thoughts of not wanting to live, then we should take that seriously, and you will save a life by getting them to the healthcare professional in time who can make the appropriate referrals and help save an individual's life. Suicide is a major public health concern. It's not just a mental health concern. It is the 11th leading cause of death in the US, and it's been the statistic for a while now for our youth population. It's even a higher cause of death. We nearly see 49,000 deaths per year, and that number consistently increase. That amounts to one person every 11 minutes. In our veteran population, it's even greater. And so, anytime someone is living with depression, it's so important that and so key that they get treatment right away because we never want an individual to fall in a deep clinical depression whereby we know that a tragic consequence of not getting it treated leads to suicide and death by suicide. Some of the risk factors I wanted to share with about suicide, I think it's important that we normalize talking about situations and we sort of get away from the myths involving talking about mental health and depression and suicide. If an individual has a family history of suicide, they're at risk. Any previous suicide attempts, meaning if they have attempted to take their lives in the past, if they had some past childhood trauma, always a history of mental disorders. If they have alcohol or substance use disorders, we are always checking and doing suicide prevention checks on these individuals because we want to make certain where they are as far as their health care goes. If someone has a history of alcohol or substance use and they increase their use, that puts them at risk. Alcohol serves as a depressant, and so sometimes what we usually see is if an individual is if they're already depressed and they're living with depression, and then they increase their alcohol intake, which serves as a depressant, then they get more depressed. And so we see them come in where they may be living with guilt because they're drinking more than usual. They're already depressed, and we have to get them to treatment right away to help get them stabilized. When there's a feeling of hopelessness, as we mentioned previously, just feeling like they have no life left in them, they have no purpose left in them, they feel like they don't have anything else to give. Those individuals are very high risk for suicide. Sometimes when like living with economy, when things are people lose their job, when they have when we having situations at work, relationship issues, any type loss an individual can experience, depending on if they're already dealing with depression, a loss it adds another risk factor to the equation. And so we watch those individuals closely because we know it does not take much more to trigger them. If there's a physical illness, meaning a chronic illness such as chronic pain, or a terminal illness, we sometimes see suicidal rates increase with those individuals. And so, as I mentioned previously, there's a um, just a unwillingness sometimes to seek treatment due to the stigma. But I believe things like talking to individuals, having educational sessions like we're doing now and webinars, just raising awareness helps to reduce that stigma when we look at the need for individuals to take care of their mental health as if they were taking care of their physical health and well-being. So just a little bit more about warning signs. Whenever someone threatens or communicates that they want to take their life, that's considered a suicidal ideation that we take very seriously. And we get those individuals to a healthcare professional who can make the appropriate referrals and get them into treatment right away. Substance use or abuse, as we mentioned previously, excessive use or increased use, that tends to increase an individual's risk for suicide. If there's purposelessness where they feel like there's no reason left to live, they don't have any reasons or anyone to give anything to, they feel like there's no hope, then those individuals are also at risk for high suicide. When we see anxiety, if they have more irritability, they have more insomnia, they have more agitation, we watch them closely. A lot of times they feel trapped, they feel like there's no way out, and hopelessness, like nothing they do will change, and life is not worth living. Isolation, we don't like to see isolation. Always try to surround these individuals with love, with care, with comfort. just be a support to them, as withdrawal and isolation is a key sign to high risk for suicide when someone's already dealing with a deep clinical depression. Rage or uncontrolled anger is a concern. Also, taking risk and living recklessly is also a risk factor. And then, if we see dramatic shifts in the mood changes, that also is a sign for us, a red flag and warning sign for suicide. And just a little bit talk about holiday blues. It's some of the symptoms are definitely similar, as I've mentioned, in anxiety and depression. However, holiday blues is not persistent and consistent as I have described in the previous talks about anxiety and depression. It's sort of fleeting and it lasts temporarily. You may have heard of seasonal affective disorder, or you may have heard of individuals just getting sad around maybe winter time, around the holiday times. Holiday times are challenging for a number of people, so we do tend to see a lot more of sadness. While it could be celebratory for some, we just have to be mindful that for some it's not. It creates more anxiety and worry, especially around financial means, and sometimes there's significant loss of some of our loved ones, and they're not no longer with us to celebrate during those times, and so it creates a sense of sadness. The stress level can be high if people are, getting prepared for meals and travel and just getting together and gatherings with family. Sometimes in holiday blues, people have trouble sleeping. They do sometimes have feelings of guilt if they can't, um, be with their loved ones, or they want to isolate. But we tend to see some of these symptoms the same that we would experience, that a person would experience in anxiety and depression. But the key to remember on holiday blues, the key difference is that it's not persistent and it lasts only a brief time. Unlike I mentioned previously with depression, it's going to be consistent 2 weeks or longer at a time. Same thing with anxiety. So if someone has holiday blues, know that it will pass as soon as the holiday pass. But if it's depression, if it's anxiety, know that it's going to be there. It's going to be consistent until that individual seeks mental health professional care. And just a few tips I wanted to share about coping through the holidays. One of the key things is getting enough sleep. Most individuals will require at least 7 to 8 hours of sleep. So paying close attention to that. There are different apps, there are different measures, and by which if you have smartphones, there's smart rings. There are also smart bands where people wear that kind of monitors their sleep, and it tells you a great deal about your stress level. And so just trying to average at least 7 to 8 hours of sleep at night will help individuals as they cope through the holidays. Proper nutrition is key. I mentioned sometimes with anxiety, depression, we may tend to see a lot of snack foods, junk foods, and where people sort of eat based on their mood. But proper nutrition, making sure that they're nutritious meals, eating enough nutritious meals, getting our proper vitamins in, having adequate water intake is key, and exercise is also key. Averaging exercise at least 3 days a week, minimum 20, 30 minutes, if it's okay with the medical profession. One of the things that I have found that's very helpful in mindfulness exercises is participating in yoga. Yoga is really a key exercise and activity. Also, sometimes people engage in meditation, that's very helpful. But key thing is try not to isolate. So if there's someone isolating themselves, it's very important that they may not need a large group of people, but there should be a few people at least checking on them. Because once someone isolates themselves, it sets them up to have more of a clinical depression. And we don't want anybody to have depression that leads to more persistent consequences of having suicidal ideation requiring hospitalization. The main thing is asking for help. No one should suffer alone or feel like they should have to suffer alone or should hide that they're suffering or living with depression, anxiety disorders. We want to normalize things by where if an individual had a physical diagnosis of, say, hypertension, they would ask for help. We want to, as a mental health professional and in the work that we do, we want individuals to feel comfortable when asking for help when they're also living with any mental health disorder. Also, sometimes helping and coping through the holidays is just supporting a cause or volunteering. A lot of times, giving back is really helpful and it's great. It sense a sense of gratitude for others. And so we find that if a person can find a reason to give back and to volunteer and to feel like they are making a difference in the lives of others, then we find that they do better in coping with the holidays as well. I wanted to close by leaving a few resources that we definitely want to make certain that we share in any talk that we do as far as mental health awareness go. 988 is the emergency call whereby if an individual is living with a crisis, they can call the 988 number, which is a crisis suicide hotline or a lifeline. There will be a crisis intervention expert on the other line where they will help them through the crisis. It's confidential, it's 24/7. They can call, they can text, they can chat. We know that some individuals prefer to text rather than call. And what I found when working with clients, if they've called the crisis line, they tend to either help them through the crisis or if they cannot, they get them to rescue. And the emergency medical system is contacted and they locate them and they get them to the nearest emergency room for evaluation and treatment. National Alliance and Mental Health is listed because I find that is as like dealing with family members, dealing with friends. If you don't have much knowledge or anyone may not have much knowledge on mental illness, I find that they can go to NAMI and there are descriptions of these different illnesses that we just talked about. There's links for support groups and communities for the client as well as the family and friends. And so I like that they offer a lot of educational content whereby individuals will understand living with mental illness much better and also be able to help them support their loved ones or gain knowledge about something that they may be living with. When we look at the Substance Abuse and Mental Health Service Administration, there's a lot of key information on living with substance use disorders, as well as mental health disorders. And we can find a number of key information and resources there as well as NAMI website as well. In Psychology Today, I like this reference because no matter where you are, and we're here all in the state of Louisiana, if someone's ready for treatment and are ready to seek help, and they don't know where to go, Psychology Today, you can type in the symptoms you might be experiencing, your location where you're located, and also it can help you identify if you have any insurance providers or not. They will link you to a provider that matches what your needs are. And so I like that Psychology Today. You can read up on the individual, you can read a bio on them and also their area of expertise. And so that's a great place to start, no matter where you're located within the state, if you're looking for mental health professionals that may be able to provide medication management, which is provided by a psychiatrist or a certified psychiatric nurse practitioner. And then they also provide list of clinical licensed professional counselors and licensed social workers who and psychologists as well, who all provide individual psychotherapy. And so that's a resource that can be shared and used throughout the state. And I've included my email there. If there are any further questions, if anyone has any questions, my email is listed. ethomas39 at Yahoo, where I can be reached for further questions or any inquiry about mental health and awareness.
Thank you so very much, Dr. Joseph, for that dynamic presentation. I'm sure you have provided tools and resources that we can all use throughout this holiday season and beyond that. At this time, everyone, we will have our question and answer segment. And just a little disclaimer for all medical questions and or advice, we ask that you please consult your physician. And at this time, feel free to drop any questions that you may have for Dr. J in the Q&A box, and you will be acknowledged by one of our team members. I do not currently see any questions in our Q&A box, so I do have a few preliminary questions for you, Dr. Joseph. The first one being, what can employees do to maintain healthy boundaries between work and personal life, especially in a high pressure or remote environment?
Thank you for that question. I would say one thing that employees can do, make certain that just be self-aware first, right? Being self-aware, knowing things like your limit, also knowing how much bandwidth you have as far as your work and your personal life goes. I think if there are things that you're doing and it's overwhelming or you're overextending, that tends to add a lot of stress and a lot more anxiety. So just being aware of that is key. And then secondly, creating space. In my calendar, I have every day I set a time at 3 p.m. and it says be kind to yourself. So just putting time in your calendar every day, no matter what. If you're just sitting there and you do nothing, but just do something for yourself that helps to create balance and boundaries. And I find that because my calendar was full, real full, and I stopped and I looked, and everything was for everyone else. And so I think you have to first be kind to yourself, and so that's why it reads that way to make certain that you're stopping and just doing even if it's just a full body scan. Because a lot of times we carry our stress and you don't even feel how you're tense and whatnot, but just stopping and pausing, taking deep breaths. I find meditation is key, just giving yourself that, even if you're at work and it's overwhelming, just stopping and sitting in your chair and take some deep breaths is even key. So I think that those are some simple things that any of us can do that helps to kind of reground you and to help you kind of reset and get back to your work and also keep your personal and that what's important for you also in the forefront.
Great, great information. Thank you, Dr. Joseph, for that. I want to ask you another question, and I'm sure that you've spoken on this throughout your presentation today, but do you have any additional coping strategies or self-care practices or the ways that you found helpful for managing stress, anxiety, or overwhelming emotions?
Yeah, so I would say probably my top go-to is meditation, whatever that may look like for individuals. If it's for just quiet time with yourself, if it's a guided meditation, there are numerous apps for that. If it's a devotional, if it's faith-based, just finding time to give that space. I also, for me, personally, just living in a space of gratitude, I find that that's a great coping mechanism for me, whereby as I mentioned, anxiety is intense worry, it's intensive fear, that sort of thing. But living in a space of gratitude allows you to think more about the things that you can be positive and grateful for, and it removes a lot of that negative space and energy. Also, yoga is really, I find that it's beneficial and effective in a lot of ways. And you can focus on yoga in so many different aspects where it can focus on certain parts of your body that may be feeling like stressed, tensed. And so I think any type of exercise activity, for me, I can only do mainly yoga. Just so because of just other I'm limited physically with how I can move now. I can't really run anymore, and cycling was one of the top things. So just find other ways. If there were things you were pretty active and now you can't be as active, find other ways by which you can. But I would say those are the top three things that I find that helps cope and that I get feedback from others that's effective for them as well.
Thank you so very much for sharing your personal testimony as to how you manage your stress in your personal life. We do have one question in our chat from a Shalita Smith. The question is, what advice would you recommend to employees who may be managing mental health disparities with their children who may be experiencing anxiety or depression during the holiday season?
Yes, thanks for the question, Ms. Smith. I would say, as an adult, as I mentioned early in the presentation, we are seeing more anxiety with our youth population, and starting very young, at a very young age. As adults, and the guardians, I would say we have to be comfortable with speaking to them about it, telling them what you observe, as well as saying and letting them know to be open with you about how they're feeling, helps you to know how to move with their physician or their pediatrician and getting them the help that they need whenever. Also it may be the educator who lets you know. And so when that information comes forth, I think the most important thing to do, let the healthcare professionals know. A lot of times they will refer to a child psychologist who can help. And I think that if the adults are okay with it, then the children will go, they won't have a trouble telling you. What I find is the stigma that we have and we carry, it prevents the adults from talking about it. So the children may not really understand what they're living with. And so I think if you're open about it with the children, and telling them it's okay to let you know how they're feeling and it's okay to say how you're feeling and be honest about your feelings, then we can get the proper treatment for children and adults.
Thank you. Thank you so much for sharing, Ms. Shalita Smith. I hope that answered your questions. That does conclude our Q&A segment for today. I do not see any more questions in our chat. Next slide, please, Ms. Brandy. All right. Our Office of Behavioral Health, Well Ahead Louisiana, was able to collaborate with our sister agency to provide some additional resources for our viewing audience today. Please be advised that these services are free, and a lot of these services and resources were already communicated to the audience by Dr. Erica Joseph. These resources are available to everyone 24/7. For example, the Louisiana Problem Gamblers Helpline. You can contact them at 1-877-770-STOP or 7867. Substance Abuse Helpline, 877-664-2248. And as Dr. Joseph mentioned, our Louisiana 988 helpline is also a free and confidential emotional support service. Third bullet, the Louisiana 211. Call 211 via your phone, or you can visit them at louisiana211.org. That is also a free service that is running 24 hours a day, 7 days a week. Our disaster distress line, 1-800-985-5990, or you can text Talk With Us to 6674. An additional helpline service is our local human services, and you can visit them at the site that is listed above you or before you, I'm sorry. And I will give you a second to take down that website just in case you need it before we proceed. Again, that is the site for our local human services. All right, next slide, please. All right, our Bureau Director, Dr. Nancy Lowenthal, did have to unfortunately step away. So I would like to speak on her behalf and to thank you all for joining today's wellness webinar. We hope that you are leaving with valuable insights and practical tools to help enhance your well-being. Remember, wellness is a journey. Small, consistent steps can lead to meaningful change. Please stay mindful, prioritize self-care, and support one another in this journey. If you have any questions or need further assistance or resources, feel free to reach out. Stay well, stay inspired, and we look forward to seeing you at future sessions. Next slide, please. Again, we thank you. Again, we are walking away more enlightened and empowered. A huge, huge thank you to Dr. Erica Joseph for joining us for today's wellness webinar. To find out more about Well Ahead Louisiana or our numerous programs or services, please visit us at www.wellaheadla.com, or you can contact us via email at wellahead@la.gov. Or if you would like to reach out to our 1-800 number, it is 1-844-522-4323. Again, that is 1-844-522-4323. Again, we thank you all for joining this afternoon. We hope that you have a safe and well holiday season.